Welcome to the often perplexing world of U.S. healthcare insurance. For many, it can feel like a complex maze filled with unfamiliar terms and intricate rules. However, understanding the basics is crucial for accessing necessary medical care without facing overwhelming financial burdens. This system, unlike many others globally, is predominantly employer-based, though government programs and individual policies also play significant roles. Think of insurance as a safety net, designed to protect you from the high costs associated with illness or injury. It is a contract essentially between you and an insurance company. You pay a regular fee, and in return, they agree to cover a portion of your medical expenses. The United States healthcare system is unique in its structure. It doesn't have a single universal system like the NHS in the United Kingdom. Instead, it's a patchwork of private and public insurers. This can make navigating your options feel daunting. The cost of healthcare in the U.S. is amongst the highest in the world. Therefore, having some form of health insurance is not just advisable, it's often a necessity. Without it, a sudden illness or accident could lead to significant debt. This essay aims to demystify some of the fundamental aspects, providing you with a clearer understanding. We want to empower you with knowledge. The journey to understanding starts with grasping why insurance is so central to American healthcare. Providers, such as doctors and hospitals, rely on insurance payments to cover their operational costs. Patients rely on insurance to make healthcare affordable. The complexity arises from the sheer number of different plans available, each with its own set of benefits, costs, and restrictions. Learning about these differences is key to selecting a plan that best suits your individual or family needs. It's about finding a balance between the monthly cost, known as the premium, and the out-of-pocket expenses you might incur when you actually use medical services. This introduction serves as your starting point. We will explore various facets of U.S. healthcare insurance in the sections that follow. We will break down key terms. We will discuss how your insurance is verified when you seek care. We will also look at the most common types of insurance plans you might encounter. The goal is simple: to equip you with foundational knowledge. This knowledge will help you ask the right questions and make more confident decisions regarding your healthcare coverage. It's an important journey, and taking these first steps in understanding is vital for your health and financial well-being. Before you receive most medical services, a crucial step often takes place: insurance verification. This is the process where your healthcare provider's office contacts your insurance company. They do this to confirm that your policy is active and that the services you require are covered under your plan. Insurance verification is incredibly important. It helps prevent unexpected bills for you, the patient. It also ensures that the healthcare provider will be paid for the services they render. Think of it as a preliminary check to ensure everything is in order before proceeding further with treatment or consultations, ensuring a smoother process for everyone involved. Why is this verification step so vital? Without it, a patient might unknowingly receive treatment that isn't covered, leading to a surprisingly large bill later on. For the provider, rendering services without confirming coverage poses a financial risk. They might not get paid if the insurance claim is ultimately denied. Therefore, the administrative staff in doctors' offices and hospitals dedicate significant time to this process. They check your eligibility, benefits, and any requirements like pre-authorization for specific procedures. This diligence helps maintain the financial stability of healthcare practices and protects patients from unforeseen costs, acting as a safeguard. To understand insurance, you must become familiar with some key terms. The subscriber is the primary individual who holds the insurance policy. Often, this is the person whose employer provides the plan or who has purchased it directly. Dependents are other people covered under the subscriber's policy, typically spouses or children. The payer is the insurance company responsible for paying claims. Examples include names like Blue Cross Blue Shield, Aetna, or Cigna. Each payer has a unique payer ID, an identifier used by providers to send claims to the correct insurance company, ensuring efficient processing. Another important term is the group number. If your insurance is through an employer, the group number identifies your specific employer's plan within the insurance company's larger system. This number, along with your individual member ID, often found on your insurance card, helps pinpoint your exact coverage details. These pieces of information are like your insurance fingerprint, unique to your policy. Understanding these terms allows you to read your insurance documents more effectively and communicate more clearly with both your insurer and your healthcare providers, leading to a less confusing experience when accessing care. When selecting healthcare insurance in the US, you'll likely encounter several common types of plans. Each has a different structure regarding how you access care and how costs are shared. The three most prevalent types are PPO, Preferred Provider Organization, HMO, Health Maintenance Organization, and EPO, Exclusive Provider Organization. Understanding the distinctions between these is fundamental to choosing a plan that aligns with your healthcare needs, your budget, and your preferences for accessing medical professionals. Each plan type offers a different balance of flexibility, cost, and provider choice, making it essential to weigh these factors carefully. A PPO, or Preferred Provider Organization, offers a network of doctors and hospitals that you can use for a lower cost. You generally don't need a referral from a primary care physician, PCP, to see a specialist within this network. PPOs offer more flexibility than HMOs. You can usually see out-of-network providers, but it will cost you more out of pocket. This flexibility often comes with higher monthly premiums. If you value a wide choice of doctors and hospitals and don't mind paying a bit more for that freedom, a PPO might be a suitable option for your healthcare needs. An HMO or health maintenance organization typically has lower monthly premiums compared to PPOs. However, HMOs generally require you to choose a primary care physician, PCP, from within their network. This PCP acts as your main point of contact for healthcare and will need to provide a referral if you need to see a specialist. Care from providers outside the HMO network is usually not covered, except in emergencies. HMOs often focus on preventative care and managing your overall health through your designated PCP, making them a cost-effective choice if you are comfortable with a more structured approach. An EPO, or Exclusive Provider Organization, is somewhat of a hybrid. Like an HMO, you are generally required to use doctors and hospitals within the plan's network. Care outside the network is typically not covered, again with exceptions for emergencies. However, unlike many HMOs, you usually don't need a referral from a PCP to see a specialist, as long as that specialist is also within the EPO network. EPOs can offer a middle ground, potentially providing lower premiums than PPOs while still allowing direct access to specialists within their defined network, offering a balance of cost and convenience. To truly grasp the practical differences, let's consider an example comparing a PPO and an HMO. Imagine you wake up with persistent knee pain. If you have a PPO plan, you could research orthopedic specialists in your plan's network and book an appointment directly. You might also choose to see a specialist outside the network, but your insurance would cover less, meaning higher out-of-pocket costs for you. This direct access is a key feature of PPOs. The trade-off is that your monthly premium for the PPO is likely to be higher than for an HMO offering similar benefits. Now let's consider the same knee pain scenario if you have an HMO plan. Your first step would be to make an appointment with your designated primary care physician, PCP. Your PCP would examine your knee and, if they deem it necessary, provide you with a referral to see an orthopedic specialist who is part of the HMO's network. You cannot typically go directly to the specialist without this referral, and seeing an out-of-network specialist would generally not be covered at all, except in a true emergency. The HMO structure often results in lower premiums, but requires you to navigate care through your PCP. Choosing the right plan depends heavily on your personal circumstances. Consider factors like your current health status and how often you anticipate needing medical care. Think about whether you have existing relationships with specific doctors and if they are in-network for the plans you are considering. Also evaluate your budget. How much can you comfortably afford for monthly premiums, and what level of out-of-pocket costs, like deductibles, co-payments, and co-insurance, are you prepared to handle? These are critical questions to ponder before making a commitment to a particular health insurance plan. To further explore this topic, there are many reliable resources available. Your employer's human resources department is often a good starting point if you're getting insurance through work. Government websites like healthcare.gov provide extensive information, especially regarding marketplace plans. Non-profit organizations dedicated to patient advocacy also offer guides and explanations. Don't hesitate to call insurance companies directly to ask specific questions about their plans. Becoming an informed consumer is your best strategy for navigating U.S. healthcare insurance effectively.